Well, good evening. My name is Michael Moore, and I'm the founder and CEO of MedKairos, where we are unlocking the potential of machine learning and digital pathology one biopsy at a time. Imagine for the last 3 weeks that you felt a lump in your neck. You're concerned, so you go to your doctor to have a biopsy performed. That doctor will use a needle like this, and they'll stick it into your neck to collect tissue. And that needle is then sent to a pathologist for diagnostic testing. Now, if you're lucky, that's the end of your journey. However, for more than 1 million patients in the United States last year, they had to go back to repeat this procedure 2, 3, even 4 times before they received a diagnosis. And according to the Journal of the American Medical Association, 20% of biopsies with that needle fail to collect adequate tissue to make a diagnosis. Now that is a problem, but we at MedKairos have the solution. Introducing Bioptic. That was an odd transition. Our product intervenes during the procedure to guarantee that a quality sample is collected. By directly mitigating that 20% fail rate, we save the average institution $1.6 million every year in direct costs associated with having to repeat these procedures. And our process is simple. You dispense tissue into a proprietary BioSlide cartridge, smear it, and insert it into the scanner for assessment, as you can see here. Our software goes through cell by cell, identifying key architecture that's indicative of a quality biopsy. And so to get this into the market, we'll be selling the Bioptic unit directly to hospitals through our internal sales channels, and then selling the BioSlide cartridge through large distributors such as Cardinal Health. But the really important part is that hospitals should expect $15 to be reimbursed for every cartridge used during the procedure, opening up a brand new revenue stream for many institutions. Our market can be valued at $1.1 billion from a bottoms-up analysis of procedure volume across all tissues shown. And we can easily translate our technology across all of them by simply developing tissue-specific software packages. There's no hardware updates are necessary. We'll initially launch this product into three partner institutions, being the University of Michigan, Mount Sinai, and Henry Ford Health Systems. We'll then hire my father, Roger Moore, who's the VP of Sales for Philips Healthcare, to grow our business into 17 additional accounts in which he already has established relationships. At which point we'll partner with large strategics to be able to grow our business into hospitals and clinics across the country. So when looking at the competition, it really boils down to 2 key offerings, either high throughput but poor quality, being the stick and stem method that I've been telling you about, or you have manual processes that provide high quality samples but at a premium financial and labor cost to the institution, like the Rose Station or Instapath. We offer the high quality samples that hospitals need without adding that cumbersome labor or time to the procedure. So over the last year, we've developed our technology and conducted more than 200 customer discovery interviews through programs such as iCore. Looking towards the future, we'll raise $750,000 in order to test our technology in a prospective study and clear the FDA. And upon that clearance, we'll launch our product into the market space. But we're already in discussions with the management of Quest Diagnostics to be able to network with their more than 2,000 hospitals across the globe as well in 2020. And then looking towards the future, we're going to continue to expand upon this platform into other tissue types and eventual diagnostic modalities such as automated pap smears. But we're not stopping there. So being that the Bioptic unit is at the point of care and able to direct clinical decision making in a way not previously possible, we can expand beyond quality assessment into biopsy triage, rapid screening, and eventually the holy grail being a point of care automated diagnostic. And being that we are a quality assessment initially, we can rapidly establish traction in the marketplace because that risk for adoption is dramatically lowered for our client institutions. And we are the team to accomplish this. Andy Kosminski and I are medical students from the University of Michigan taking full-time leaves to pursue this business. John Dollar is a serial CFO in the med tech industry. Roger Moore has more than 35 years of medical device sales experience. And Mitchell Greist is an expert in machine learning and AWS coding. There we go. Our advisory board is backed by industry experts and successful entrepreneurs. But specifically, I want to highlight Dr. Belize, as he's the world's foremost thought leader in pathology informatics, and he's the one making sure that our software has the clinical validity necessary to impact patient care. These companies indicate a general trend for exit via acquisition in our industry, and it tends to be between 6 and 10x of revenue, and that tends to be in about 7 years after foundation. With our product in the market space, there won't be a second time going back to the hospital. We offer patients the peace of mind of knowing when you expect results, that's what you get. Thank you.